itself. That's the miracle of life, and it continues ongoing. We think, okay, we were born, that was a great miracle, but that miracle continues through our lifetime. Back pain not only affects adults, but children as well, as I said earlier. According to the recent study in the Scandinavian Journal of Rehabilitative Medicine, nearly 51% of school children suffered with low back pain. They just don't talk about it because they have a pain here, a pain there. And by the time they come in and they're 25 or 30 years old and they're having this back pain, and you ask them, have you ever had an event coincident with the onset of this pain? And they're going, what are you talking about? They said, I fell off the monkey bars when I was a kid playing on my head and bounced a few times, but other than that, no problems. And yet you see degeneration at an early age, and you're wondering what caused that. It set the stage through instability of compression, advanced compression that produces degeneration. When that degeneration occurs, it compromises the disc space, and we'll talk about that in a moment, which then puts pressure and stress on a nerve. And again, it's that pressure and stress. I like to call back pain the game of the gap. If you don't have the gap where the nerves exits the spinal cord, you're out of the game. It's a game of the gap. You need enough room. It's mechanical. There's no mystery to it. It's nerve pressure. It's nerve stress. A significant risk factor included age, gender, amount of time in front of the TV, and involvement in competitive sports. Double-edged sword. You have too much competitive sports and you bump heads, what happens? Concussions, spine injuries. On the other hand, if you sit in front of the TV too long, it's almost a competitive sport because you're reversing the curve of the back and you're producing trauma, micro trauma, that can be as significant as macro trauma, which is an impact type injury. So when we talk about who it affects, it's the most common type of pain due to the fact that the lower back supports the majority of the body weight. The lower back at the bottom of the spine, I want you to think about this. There's 24 freely movable vertebrae stacked one on top of the other. If you took 24 football players and put them on a field, each one of them represented a vertebra, and they all piled on, which one do you think would get squished the most? Pretty simple, the guy on the bottom. So the majority of your body weight is pushing down on your vertebra constantly, so it's constantly under load. It's constantly being compressed. For this reason, it's the second most common cause of Americans to see doctors. Low back problems can lead to nerve irritation. When the nerve involved goes down the leg, it's called sciatica, because that's the sciatic nerve. Sciatica is a condition involving pain, weakness, numbness, and tingling. And it can be transient. I see patients that come in and say, well, you know, there's nothing wrong with my back, but I have pain down the leg. And yet reality, the pinching or the pressure or the tension or the stress on the nerve is where the nerve exits the spine in the lower back. And that's at the sciatic nerve. According to the American Academy of Orthopedic Surgeons, it's most likely to occur around ages 30 to 50. And 80 to 90% of the people are treated and get better without surgery. 80 to 90% of the people can actually get better. Now, they didn't say cured, because I believe the only thing that you can cure is ham. I have been in practice. I've been in practice 40 years, and I don't believe I've ever cured anybody. But we do a darn good job of managing. And I think when you think in terms of managing your back, you're thinking the same way as managing brushing your teeth. Do you brush your teeth? Yes, you do. If you go into the dentist, and the dentist does a great job, they do drill and fill. And you come out and your teeth look wonderful, and you smile and you go, yeah, it looks really good, and the cavities are gone and I feel great. Do I have to keep brushing my teeth? And the dentist says, absolutely not. Just the ones you want to keep. And yet we don't think about that with our spines. Our spines are there permanently. You can take your teeth at some point in your life out and put other ones back in. You can have dental implants. You can do all kinds of miraculous things today you couldn't do back in the day of George Washington with your teeth and your smile. You only get one spine, and it's got to last you from birth until death. And so it's so important that we rekindle in our youth, in ourselves, the importance of posture, muscle strength, diet, all the things that we can do to prevent. I'm going to get in really specific. I want to get in some really neat things that you can do next week. But tonight I want to continue to build this case, because think about what we're saying. Sciatica is most likely to occur around age 30 to 50. In that 20-year period, what have we done? We've climbed the trees. We graduated from high school. Many people go to college. As soon as you go to college, you start sitting more. You start dressing better. You start trying to not perspire as much, and sooner or later you get married, you go to work, and you slow down on the exercise. You start sitting more. Where you used to be running up and down climbing trees, you're now sitting much more. The spine becomes abnormally stressed. And at some point you reach that critical mass. You exceed the pain threshold. Because we live in an area of dysfunction, often not knowing that. And I'm not talking about our families, I'm talking about our spines. A dysfunctional spine is one that's lost the normal spinal dynamics because there has been impact injury, or there's been repetitive stress or microtrauma to the muscles, tendons, and ligaments. And now all of a sudden we cough, sneeze, bend, twist, move, bend over to pet the dog, put on our shoes, and my back went out. You run to the doctor's office, you walk in and you go, hey, I didn't do anything. First thing you want to do is make it clear you're not responsible for it. And the doctor looks at you and he says, well, you got a spasm in your back. So what do they do for a spasm? Does anybody know what you do when you have a spasm in your back? Is they give you a muscle relaxer. Now think about it. At age 30 to 50, you're now setting the stage for disuse atrophy. The muscles are becoming less strong. Now all of a sudden you bend, twist, move, and your back that's not strong exceeds the pain threshold. It goes into a spasm, it splints. You run into the doctor's office and that muscle is splinted, and they make it weaker. You take a muscle relaxer, it's counterintuitive. They really give you 3 pills. They give you a pain pill, a muscle relaxer, and an anti-inflammatory. And bear in mind, most physicians have almost zero education in nutrition and very, very little education whatsoever in back pain, except for 3 things: muscle relaxer, pain pills, and anti-inflammatories. That's pretty much your education. Give it to that. Give the patients those 3 pills. If they don't get better, send them to the orthopedic surgeon and they'll do surgery. And I'm not saying that people don't need surgery. There are people that have train wrecks and their spine is like Humpty Dumpty that has to be put back together again. But if we make that first line of treatment, we're actually potentially doing more harm than we are good. So coincidentally, around 30 to 50, we reach that threshold, and we now have weak muscles. If we take muscle relaxers, even though it may make us feel better for a while, it's counterintuitive. What we really need to do is immediately introduce kinetic activity and strengthen the muscles, because the spine has become weak. So the primary cause of back pain comes from misalignments of the spine, causing swelling and pressure on the nerves that exit the spine. It's called a pinched nerve. When a nerve exits the spine, if the joint becomes inflamed, we call that, let's see if this is going to work. We call this hole where the nerve exits the intervertebral foramen and the joint next to it, that's called a facet joint. That facet joint is, in medical terms, anatomically, it's called a diarthrodial joint. It's a freely movable joint. Your elbows, your knees, your ankles, your wrists, your hips, they're all joints that have self-lubricating sockets that are around it. The facet joints move and glide. They allow you to bend, flexion, extension, lateral bending, and rotation. Now, I'm telling you that for one reason, to tell you this. Has anybody in here ever had a sprained ankle? Just about everybody. What was the first thing that happened when your ankle was sprained? It swells. Tissue reaction to an injury, by definition, is inflammation. So inflammation occurs. When the inflammation occurs in this space, right here, that facet joint that articulates and allows you to move, there are no blank spots in the human body. We have no extra parts, so if you take something out, there's nothing, you don't have an extra one. And we have no blank spots, which means when it swells, it's swelling out into other soft tissue. If it happens to be right here, it's right next to one of these nerve roots. And when it swells, it will put pressure on that nerve root. It stresses it. And it's that stress and that inflammation that causes the pain, whether it's locally in the lower back or if it is radicular or it radiates down the leg. So the three medications you could take, a pain pill, a muscle relaxer, or an anti-inflammatory, which pill do you think would be the best one to take? Anti-inflammatory. And if you take enough anti-inflammatories over a prolonged period of time, what happens? You get gastric ulcers. So there's always an up and a downside to medication. And I'm not against medication. I think medication is wonderful. I'm not against nutrition. I probably have as much education in nutrition and homeopathy and naturopathic medicine as you can get. I now tell patients to eat chicken, fish, fruits, and vegetables. That's my whole diet program, and you go to H-E-B or Kroger or wherever you want to go and get it. Why? Because they're whole foods that you need to eat, and taking a lot of pills is not necessarily going to cure your problems, whether they're vitamins or whether they're drugs. The idea is that eat the food. I have a strict formula. They say, well, Doc, what kind of food? I said, if God grows it, you can eat it. But if it's in a can, bottle, or a bag, don't touch it. And you go, well, that's everything. Yes, pretty much. It's just about everything. I tell patients out at my clinic in Katy, I said, when you walk into H-E-B, turn right, do a few circles, and then leave. Because there's nothing else in there that's very good for you. In fact, in a few minutes, I'm going to have you, did those handouts make it with, we're going to have some homework for next week. Okay, I'm going to move along pretty quick. When the segment of the vertebra of the spine called the vertebra become misaligned, it can produce a luxation, a malposition or misalignment. Another cause of back pain is the bulging of the disc. The disc is a shock absorber. The shock absorber is a hydraulic means and method to support us for impact, but it will not last forever. One of the reasons that over the years of fitness and exercise, I have grown to really dislike running, jogging. Walking is wonderful, but my personal opinion, at 67 years on this planet, I have come to the conclusion that everything goes up has got to come down. And every time you slam down and you hit your knees and your hips and your spine and your neck, it sets the stage for compression. And a lot of people out there going, yeah, but it's good for aerobics. It's wonderful. The guy that wrote the book on aerobics that started the thing died running. That's a fact. He died running. Discs bulge and protrude onto nerves with direct nerve pressure. If you look at this, where am I? If you look at the normal nucleus, that's called a mucopolysaccharide gel. And if you have a weakness back here, and it eventually bulges posterior lateral and puts pressure on that nerve root, which is right here, you've got pain. And that pain's not going away until the pressure gets off that nerve. So if it's compressed, you've got to uncompress it. It's pretty much that simple. Now you can cut through muscles, tendons, and ligaments and remove the disc that's bulging and say a prayer and hope that Humpty Dumpty goes back together again. Or there's some other mechanical ways that you can do it, but that bulging of the disc right there, posterior lateral, is the area that will produce pain. What if it bulges in the front? It doesn't cause pain. So you've got a circumferentially an area 360 degrees where it could bulge, but if it goes posterior lateral, it's going to hit the nerve root. You know what the weakest part of that disc ring is? Posterior lateral. That's the weakest part. And I asked a doctor in Pocatello, Idaho one time when I was at a seminar, he was teaching the postgraduate orthopedics, and I said, why is the annulus weakest posterior lateral? He said, that was God's way of giving orthopedic surgeons something to do. And I did forget to ask, are there any orthopedic surgeons in here tonight? Okay, I'm in good shape. All right. Pain anywhere in the body is caused by nerves that are being irritated or excited or stressed. It's pretty much, if you feel pain, you got a nerve being irritated somewhere. Why do so many Americans have problems with their backs? There's 4 reasons. Number 1, lack of exercise, poor posture, physical trauma, and emotional stress. I would say that all of this has to do with stress. It's aggravated if you have an excessive amount of weight that exceeds the load capacity of the spine. You have to think about that. If you could take a 50-pound sack of corn and throw it off instead of carrying it around the rest of your life, you got the choice. The question is, how do you get there? Usually discipline. And discipline is one of the hardest things that we found to teach patients. There have been thousands of studies outlining the benefits of regular exercise. Unfortunately, Americans continue to avoid exercise thinking that it might exhaust them. But the truth of the matter is, the exact opposite is true. The more you exercise, the more energy you get. If you were sitting in a circle of fire and you're right there and you're going, it's awful hot here, and that fire's coming in closer, you got 2 choices: sit there and burn, or get up and move out of the fire. Well, I'm going to get hot. Yeah, you're going to get hot, or you're going to die. Pick one or the other. So sometimes we have to do things that are uncomfortable. We have to get out of our comfort zone and get more energy. Wow, there's no downside to that. Am I doing this wrong? Oh, there we go. What's the result of all the sitting, relaxing, and watching TV rather than being active? Statistics don't lie. 31 million Americans have low back pain at any one time. 31 million Americans woke up this morning with back pain. They didn't all run to the doctor. Only 1 million of them go every month. But 30 million Americans every day wake up. Each year, 1/2 of all working Americans admit to varying degrees of back pain, and 1/3 of all Americans over 18 have had back problems in the past 5 years. So if you have back pain, you know somebody's got back pain. They're not in the boat alone. This figure down at the bottom says it's a staggering $50 billion, but if you look at the bottom of the slide, it says 2005. 11 years later, it's $150 billion. If you spent $150 billion, wouldn't you think you could find a cure for back pain? Why isn't there one cause, one cure? And the reason is because we are living tissue. Anything and everything that we do that regards to our body is a